Good morning, everybody. Thank you for joining us. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar through our website at www.nhadaca.org. After completing this webinar, please upload and complete the quiz if you're interested in receiving your certificate. You can find the quiz in the file pod throughout the presentation, which is to the right under Cheryl's picture, on our website at nhatica.org, or you can email the Training Institute at nhatica.org to request it. You can email, mail, or fax the completed quiz, and you can see the contact information below throughout the presentation. If you're a member of NHATICA or NADAC, the certificate for this webinar is free. If you're not a member, the fee is $15. You'll receive a certificate worth 1 CEU once you have completed and passed the quiz and paid for the webinar if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this one-hour event is pre-approved by the New Hampshire Board of Licensing for alcohol and other drug use professionals. If you have any trouble viewing the webinar, audio problems, or have any technical questions, please contact us at 603-225-7060. Again, you can find this information at the bottom of the page throughout the presentation. Please email any questions regarding the material you see today to traininginstitute@nhatica.org. And with that, I'm going to turn you over to Cheryl Pacapelli, who's going to introduce herself.
Hi, everyone. This is Cheryl Pacapelli. I'm a person in long-term recovery from alcohol and other drugs since June 28, 1989, and I'd like to welcome you to the webinar, Peer-to-Peer Recovery Support Services, Developing a Recovery-Oriented System of Care. So I'd first like to just give you a little bit about myself and how I got involved in 2001 in providing peer-to-peer recovery support services when I opened a recovery living center for men called Stepping Stone House. This transitional living center helped men to transition from jail or discharging from treatment into mainstream society and allow them to achieve their recovery goals. Through that, I got involved as a volunteer with the Connecticut Community for Addiction Recovery, which in Connecticut is their statewide recovery community organization. I ended up working there for 8 years and began to develop a passion for what I saw peer-to-peer recovery support services do and the way they were delivered there. So through my work there, I managed a recovery housing coalition, worked on the telephone recovery support program, managed 3 recovery community centers, and a volunteer program. And that is what ultimately brought me into New Hampshire, where I now work as the executive director for Hope for New Hampshire Recovery. So Hope for New Hampshire Recovery is the local statewide recovery community organization here in New Hampshire. And our goal at Hope is to assist in the design and implementation of a statewide network of peer recovery support services and community-based recovery centers. Hope for New Hampshire supports an individual and family in any pathway to their own recovery. So in New Hampshire, they talk about resiliency. And what exactly is resiliency? Resiliency is the ability to spring back, rebound, overcome diversity of all kinds. This capacity is hardwired into everyone. So through building resiliency into all of our programs as we treat substance use disorders here, people will have the option to be able to get back into their communities, rebuild their lives, and live productive lives as they move forward in their recovery. The Substance Abuse and Mental Health Service Agency, known as SAMHSA, held a national summit on recovery in 2005. They defined recovery from alcohol and other drug problems as a process of change through which an individual achieves abstinence, improves their health, wellness, and quality of life. So that came from a national summit that they had where recovery community organizations from all over the country came together and agreed on that as a definition of recovery. So, but what exactly is a recovery-oriented system of care? So from a report from later on in August of 2009, the definition of a recovery-oriented system of care is that networks, organizations, agencies, community members, they all coordinate a wide spectrum of services that prevent, intervene in, and treat substance use problems and disorders. So ROSC, as it's known, is a new approach to how we're going to treat people with substance use disorders. And so some of the things that are really important when we're talking about ROSC is to understand that everything in your ROSC model of care are person-centered. Each individual will get exactly what they need. ROSC is not a cookie-cutter model that it needs to be able to move and shift based on the needs of the individual seeking help. So by implementing a ROSC system of care, we'll be able to expand the community's ability to be responsive to the members who are seeking recovery. We'll be able to offer a comprehensive array of services that can be combined and adjusted to meet the individual's needs and different chosen pathways to recovery. This will be a huge shift in from what we do today to moving New Hampshire to a ROSC system of care. So what exactly is it? So it's a paradigm shift. ROSC is not just one program. You have to take the ROSC principles and move them through your entire program. It's a new way of thinking about the services that are going to be delivered. It's an approach to service delivery that fosters community support and different opportunities. So understanding the other opportunities that are in your community, if you provide a treatment service, what other community supports are out there, understanding how they can help with whatever client you may serve is an extremely important part of a ROSC model, and using all the local resources that you have access to. It is not just one direct service, all that stands alone. This has got to be a full wheel with a whole lot of spokes with that person right in the center that we can help them. This approach thrives on integrated care systems. So everything has to work together and communicate with each other, and people need to be able to walk in any door of that integrated care system and be able to get the services that they need or a warm referral to those services. It's person and family centered, and it supports a chronic disease model for treatment. As we begin to treat addiction as a chronic disease, having a recovery-oriented system of care in place will be essential. We have to stop treating addiction as an acute care model of treatment, which would mean, that when people are seeking services, they are not denied services. that they have access to every type of service they may need, from treatment to recovery supports, and we have to stop treating addiction as if it was a broken arm, and we provide you with a detox service, and then we tell you to go to meetings. So in New Hampshire, this is a priority. Everyone at the state and federal level is shifting to a recovery-oriented system of care and beginning to bring all this information together. So, as part of the ROSC model, there are 12 guiding principles, and this is what we have to do to move into the ROSC model. These came, again, from the SAMHSA conference in 2005, and this is what we need to use to develop our measures and establish evidence-based practice as we begin to implement a recovery-oriented system of care. So one thing we have to do is we have to remember that there are many different pathways to recovery. People come into recovery from all different areas. There might be people that come into recovery through medication-assisted treatment. We need to support that. People may come into recovery just because maybe they had some type of motor vehicle accident, and now they understand, they can no longer drink, so how can we help them? So we need to be open to be able to help anybody in the recovery and understand that the individual knows what is best for them. So there's many pathways to recovery, and having recovery be self-directed and empowering helps the individual to understand their role in their recovery process, understanding that they know that what kind of help they need, whether it's employment help or housing help, to be able to help them to navigate the system, to be able to get the services that they'll need going forward. Recovery also involves a personal recognition of the need to change and transformation. So when people typically enter recovery, they know that it's time. They're at the end of the road. Sometimes it's referred to as their bottom. But not everybody needs to reach a bottom. They can enter into recovery at any time when they realize that the life that they're leading needs to change. So we need to be able to be open to that and help people at whatever stage they are to enter into their own personal recovery process and support that. And recovery is holistic. It has to treat the whole person, not just one piece of the person. Has many different cultural dimensions, and as we see people in treatment centers or recovery support centers or in the ERs, we have to understand all those cultural diversity issues that may come up. And recovery exists on a continuum of improved health and wellness, where as people enter into recovery, we'll see that their access to their primary care physician goes up. Their need for emergency care goes down. They typically will find jobs, and their financial situations will improve. So this is all, recovery is just one part of the continuum that will help heal that whole individual. So recovery emerges from hope and gratitude. So instilling hope into every aspect of your program and understanding that recovery and addiction treatment is a relapsing disease, and being able to give people hope that if they keep trying, they can get this. They can get better. They can be in recovery, and allowing them the opportunity to continue to try while treating them with dignity and respect throughout the entire process. Recovery involves a process of healing and redefinition. So what does that really mean? Like, we have to relearn who we are, and recovery is an opportunity to make ourselves into the best person that we can be. And for each individual, that's going to be different. For me personally, it was about learning, going back to the things I used to love to do as a child and relearning them as an adult, to be able to find out who the person I was. And I had the privilege of being able to do that early in my recovery. So recovery also involves addressing discrimination, shame, and stigma. And so I think that as I introduced myself early in this presentation as a person in long-term recovery for 25 years, I do that so that people know that recovery does exist, recovery is possible, and that there is hope that people do recover. So I know that for me, it was everybody knew that I was using drugs and alcohol. So for everybody to know that I'm in recovery today is not a problem for me. I'm proud of it. And by doing that, maybe that will allow someone else to seek treatment, because that's one of the biggest reasons why people don't want to seek treatment, is because they're ashamed of the stigma associated with it. Recovery is supported by peers and allies. Our family members, our significant others, our children are all our allies. And so the support of the whole family is extremely important in a ROSC model. And recovery involves rejoining and rebuilding your life in the community. So being able to get started and thinking about what you can do to help your community. And I know for me, I had taken so much from my community while I was in active substance use, that being able to be a participant in my own local community was something that really kept me engaged early on, that I felt like I could do something to help someone else. So, and recovery is a reality. There are 23 million people in long-term recovery in the United States today, and I think that's an important message that we have to get out there, that there are people in long-term recovery, that all the work of treatment centers do work, and they initiate people's recovery. They let them know that treatment is available, and that it initiates the recovery process. So some of the other elements that we need to think about as we start to develop a ROSC model that were identified at the National Summit are that they are person-centered. That individual who comes into wherever they enter the continuum, whether it be at a prevention point, a treatment point, an intervention point, a recovery supports point, that it's all about them and what do they need. And then being able to engage families and other allies, community allies, helping families to really understand what addiction is, what recovery is, and how they can support their loved one in that process, and is an essential element. So we also have to make sure that we have systems throughout the community. We can't just have one place that people can go, and we need to work together. We can't do this alone. So we have to have a continuity of care with continuing care, and all the different people need to work together: prevention, treatment, recovery support services, primary care doctors, and we have to work more in collaboration. So if someone ends up on my doorstep and they really need treatment, I need to be able to make that phone call and get them into the type of service that they need right then in that moment. When I ask for treatment, ask for help, people had been telling me for probably years, I'd like to say months, but probably for years that I needed help. And at 4:30 one morning on June 28th, 1989, I picked up the phone and asked for help, and I was in treatment within hours. That's how this works. Like, we have a moment in time that we can help people. So had I not been able to get help right at that moment, I don't know that I would be here today. So understanding that when people are ready and want treatment, we have to be able to give them access to it. So we have to make sure that it's strengths-based, individual strengths. Every person comes to the table with individual strengths, assets, and resiliency. So how do we engage them early in their recovery process to be able to use those strengths that they have? And we'll be talking about it a little bit later on about recovery community centers and the ability to be able to take those people's individual strengths. If they enter into recovery and they have a passion for doing artwork, allowing them to work at a recovery community center as a volunteer and do art classes, pencil drawings, watercolors, and give them hope and let them teach someone else and be a part of the community is an unbelievably way to get people engaged and keep them engaged. And we have to make sure that everything is culturally responsive and we understand what the cultural diversity in our local communities are. And we have to be open to that personal belief systems that not everything is 12-step recovery based. There's many other pathways to recovery, and allow people to make that choice for themselves and what their recovery process is going to look like. We have to make sure that we have a commitment to peer recovery support services, and we're going to talk a lot in depth about what peer recovery support services are and what they can bring to our local communities. The inclusion of the voices of individuals in recovery and their families. I'll tell you, in New Hampshire, that our voices are starting to be heard, and we're going to talk about some different things where people came out. It's absolutely crazy that we don't have the treatment and the recovery supports and the prevention services that we need in New Hampshire, and people are starting, there's an outcry right now of family members and people in recovery saying that, this is just not acceptable. So we need to have you continue to do that to make sure that recovery is part of the conversation. And this is much different than what we're used to doing. Typically people in recovery, only the people in your immediate family might know that, not people at work because you're ashamed and there's stigma associated with it, but it's more and more people speak out about their personal journeys and their journey into recovery. The stigma will lessen. We also need to make sure that, as we try to move towards this recovery-oriented system of care, we see every opportunity where we can integrate services and understand that everybody needs education on what we're doing and how we're doing it, and the training has to be ongoing. Absolutely. We can't think that we're going to put a new paradigm, shift this whole process to a recovery-oriented system of care and not continually do education, training, and outreach about that. And it's got to be outcomes-driven. We need to make sure that all the programs and the services that we're delivering and the way that we deliver them is based on research of what works, what has worked in other states that are similar to New Hampshire, and we need to be sure, and this is, the hardest thing I know, that it's adequately financed and there's some flexibility in that financing strategy. Because, again, this is all person-centered. It's not about a strict, this is the only way that it's going to work. If someone comes into your place and says, everything would be great in my recovery, but I'm an electrician and I don't have steel-toed boots, and I could have this great job if I just had steel-toed boots. The system needs to be able to finance those steel-toed boots to allow that individual a way to get a job and to be able to stay in his recovery process or her recovery process. So they might not need like a whole training on employment services. They have a job. So we need to be able to be flexible enough that we can serve each individual with what they need to achieve their recovery. So we talked a little bit about, I mentioned peer-to-peer recovery support. So what exactly is that? What is a peer? And a peer is anyone that self-identifies and is willing to share their experience, their lived experience with others. So a peer could be a family member, a peer could be a person in recovery, a peer could be someone who is on medication-assisted treatment, on how they got on it, how it saved their life. It can be anybody. So a peer has a pretty wide open definition of who can help. And so some peer-to-peer recovery support services are delivered at typically recovery community centers. So we're going to talk a lot about that. One of the services is telephone recovery support. And telephone recovery support is a service that is very simple, that when someone either gets out of treatment or a drug court or outpatient or moves into some type of a residential recovery living center or sober house, that they sign up to receive a phone call once a week or every day if they needed it, again, person-centered, that they could talk about whatever was going on in their recovery. So this service would be provided by trained volunteers to just check in. How you doing? And we're going to talk, a little bit more in depth about that in a couple more slides. Another peer-to-peer recovery support service is called recovery coaching. And recovery coaching in its simplest form is someone who is trained through in New Hampshire, we use the CCAR Recovery Coach Academy, but it's like a cross between a 12-step sponsor and a case manager. So somebody who understands that's in the local community. So if you needed food or you needed shelter, they would know where those things are, as well as if you wanted to go to some type of 12-step meeting or some type of faith-based meeting, they would know where those things are. So, a cross-section of a person that can give you both. Typically in a 12-step meeting, a sponsor can help you to stay in recovery for that day, but they might not be able to tell you where you can go to a food bank for food for your family, or where you could go to get help because you can't pay your electric bill. So a recovery coach would help to guide you through all of those services. And then all recovery meetings where everybody that has anything to do with the recovery community are invited. So people in long-term recovery, people with a day in recovery, family members, people that are in recovery from gambling, from alcohol, from drugs. Everybody is welcome at that meeting, and they share their experience, strength, and hope to help others to achieve recovery. So all recovery meetings kind of take the stigma away. People, sometimes people that are on medication-assisted treatment have a hard time going to 12-step type meetings, and at an all-recovery meeting, everybody is welcome and supported in their pathway to recovery. So peer-to-peer recovery support services, part of it is doing a little bit of advocacy and showing that recovery is possible and that recovery works. And HOPE has an annual rally called We Believe in Recovery And we held it for the first time last year in Concord, and this year it'll be held in Whites Park in Concord on September 26th. So if you can mark your calendars for that, we're going to have some more details towards the end of the presentation on that too. So for people who aren't familiar with recovery support services, we have this really great treatment community where, you know, people are getting treatment and people's recovery is being initiated at that point. Hope is being instilled. And then if they don't have any supports after that. So what recovery support services is kind of bridges the gap between our treatment community and the big recovery community that's out there in New Hampshire. So by providing those recovery support services, people can actually get across that bridge and be able to achieve long-term sustained recovery. And we need to be able to help them to do that. So it's a two-way bridge. The recovery community has to be able to go into the treatment community to talk to them, instill that hope that recovery is possible, recovery is real. And the treatment community has to be willing to say, we did our part, and now I'm going to hand you over to the recovery community, and these are the services you can get there that can help you to maintain and sustain your recovery. Oh, so now we have a poll question that I'm going to bring up. So you can feel free to answer this poll question. And that question is, how many guiding principles are in the ROSC model, the Recovery-Oriented System of Care model? Would that be 10, 12, or 17? And I'll give you a minute to, well, not a minute, I'm going to give you 5 seconds. Okay, great. We had 6 responses and 6 people got the question right. The answer is 12. There are 12 guiding principles in the ROSC model. Excellent. So if anybody has any questions, they can type them in the little chat box on the left, and we'll this is a good time to ask any questions about what we've talked about so far. And if not, no questions at this time, but feel free to put any questions in that chat box that is at the bottom left of your screen, and I'll be happy to answer them as we go along. So here's a little mock-up of a recovery community center, what that could possibly look like. And recovery community centers are located, they're a physical location that would be anchored in the heart of the community. So they aren't on the back road, they aren't hidden, they're right there on Main Street or Elm Street, so that people know that people are recovering from this disease, and we need to be a part of the community so that people can participate and feel welcomed. So it's a physical location where the recovery community can organize, plan events. It's a place where peer-to-peer recovery support services are designed and tailored by the local recovery community. So in New Hampshire, HOPE's plan is to help to assist in establishing these recovery community centers throughout the state. And each recovery community center will have the same core services, telephone recovery support, recovery coaching, a volunteer management system, all recovery meetings, and then some family support groups. And then all the other activities will be designed by the local community. So in Portsmouth, if there's a recovery community center in Portsmouth, maybe they're going to have a fishing club because they're near the ocean. In Manchester, there's a huge arts and music and cultural community that goes on. So maybe that's, there's going to be karaoke nights or open mic nights or poetry slams. So the local recovery community will be able to design and deliver the services that that local community needs. And so all of this is driven by a volunteer base of people in recovery, family members, and allies that want to help put this on and volunteer their time and their energy to help other people to achieve long-term recovery. So one of the first services, and we talked about it briefly earlier, would be a telephone recovery support service. So a HOPE volunteer would call someone new in recovery. We call them recoverees, like a sponsee or an employee, once a week, and we'd call for at least 12 weeks to offer support and ask them, what they need to maintain the recovery. And if there was a local recovery community center, we could invite them down to different activities that were going on at the center that day. For the volunteer, it's a great way to be able to give back to the recovery community. And for the person who's receiving the call, they receive support for their recovery. So just as if you're hospitalized for heart disease or pancreatitis or some condition, when you left the hospital, usually within 24 hours, someone's calling to check up on you, remind you that you have a scheduled doctor's appointment, remind you that, if you need a cooking class because you have diabetes, where you could go get that service. So telephone recovery support would do just that. Volunteers would be trained on the local resources in the community and be able to tell people how to access those services and help them navigate through whatever it is that they need. If they need housing or they need food or they just need someone to talk to. And this is like a great service for people who are a little isolated, might live, north of the notch and not be able to get to meetings or a recovery center. They at least could, have someone that they could talk to every week, or if they needed a call every day, they could be called every day. So this is a program that will be run 100% by volunteers that are trained in how to make telephone recovery support calls and how to access different services in their community. So this is like a great way for people to get involved, both as new in recovery and people with long-term recovery. So, all right, so does this really work? So this is data that came from the Connecticut Community for Addiction Recovery. And if you look at this, the enrollment period of at least 12 weeks shows that there were 1,453 people that were totally called. And 1,203 people actually stayed in recovery for the entire 12 weeks that they were called. That's 84%, okay? And the important thing to recognize in this data is that we do have 16% of those people that were enrolled for 12 weeks did relapse. 16%. That's still a rather low number. But of those 16%, every time if you said you relapsed on that phone call, we would ask you, do you want us to call you again next week? And if you said yes, we would call you again next week. And at that point, 81% said they were back in recovery on the next phone call. So that's a tremendous number, because what that does is typically this is an isolating condition. So once we relapse, we go into isolation and we just use and use and use until we end up in the emergency room. With telephone recovery support, if we can get 81% of people back on track after they relapsed, that's amazing, and the cost savings are astronomical. Of those people aren't going to need ER services and inpatient treatment. Maybe they need outpatient treatment. Maybe they need a relapse prevention group. But so the ability to be able to check in is has a profound effect. So we have another poll question. And let's see what we have for our second question today. And this is, guess what? I didn't say the answer. So we're going to let you guys guess. New Hampshire is the only state in New England that does not have recovery community centers. Ooh. Two more seconds to get your votes in. Okay, so the answer to that question is true. So I'll just go back to over here, right? Okay. Okay, and we're back on. Sorry for the little technical difficulties in there, and the fact that I didn't give you the answer to that question before we did it. So the poll question was, is New Hampshire the only state in New England not to have a recovery community center? And the answer is yes. We are the only state. Connecticut has 3, Massachusetts has, I believe, 5, Rhode Island has 3, Vermont has 12, and Maine has at least 2 that I know of, and New York has multiple. I don't know the exact number. So we talked a little bit about recovery coaching, and in New Hampshire we are using the CCAR Recovery Coach Academy as the training to start people to become peer recovery support workers, which is a total of 100 hours of training, and the CCAR Recovery Coach Academy is 30 hours of that. We don't have enough time to talk about all the details of that, but my contact information is at the end of this, and I'll be able to talk to you about any kind of details of becoming a recovery support worker. This is just one piece to achieve that certificate. So the Academy will describe the different recovery coach roles and functions. We'll list all the components, the core values, and understand the guiding principles of recovery. We'll work on building skills to enhance relationships. So different kind of motivational listening and that type of thing. We'll talk about different dimensions of recovery, different pathways to recovery, and the differences between a recovery coach and a sponsor or a case manager and talk about, that recovery coaches don't provide any clinical services. We have people that are trained to do that and would make referrals for clinical services. We'll talk about, the issues surrounding self-disclosure and sharing your story in public, and what does that mean? And, for not everybody is it okay, and that's fine, but if you do want to share your story and talk about being a person in recovery, how do you do that, and what's the best way to do that? And how do you do it as a recovery coach? And understanding the different stages to recovery or getting into recovery, when I'm thinking about it, maybe I have a problem, and how best to work with people. And understanding the stages of change and how they would apply to the individual that you're working with, how to best use them to help people in their recovery. Increase awareness of culture, power, and privilege, understanding what all that means, the different aspects of cultural diversity, and things that we, at least before I took this academy, didn't understand power and privilege at all, and how that is in our culture and we don't even see it. So being able to recognize that and address it within yourself. Talk a lot about ethical and boundary issues, what you should do as a coach, what's not okay as a coach, as well as what your organization or whoever you're volunteering for expects from you as a recovery coach. And we begin to talk about recovery wellness planning and the 7 dimensions of recovery wellness, and from spiritual dimensions to health, education, housing, and learn how to help our person that we're helping to achieve their long-term sustained recovery, how to build that plan, and how to teach them that it's their plan, and you're going to give them guidance on how to achieve those goals early in recovery. And then we also do some role plays on how do you practice those newly acquired skills. So in New Hampshire, right, we're going to be hosting a CCAR Recovery Coach Academy, July 27th through the 31st, and you can visit Hope's website at hope4nhrecovery.org under training and events for more information, or feel free to contact me directly. So what exactly will a recovery coach do? We know they don't provide clinical services, so what are they going to do? They're going to help people to make a good decision. Early in recovery, we typically don't know how to make a good decision, so we have to relearn that skill. So a recovery coach will help people with that. Learn how to reduce the amount of use if that's what your path to recovery is, or maybe abstinence is your path to recovery. And so how can we help you to stop different behaviors, stop different attitudes so that you can achieve recovery? We're going to work on your wellness plan with you so that you can make progress in recovery. This is the individual's wellness plan, not the coach's wellness plan. So it's all based on the ROSC continuum of care. We'll support all pathways to recovery, not only abstinence-based recovery. Focus on the future. Coaches cannot work with trauma. We'll make referrals to treatment or clinical providers for that kind of stuff. All we can do is share our experience, strength, and hope of our lived experience. So if someone has an issue that requires clinical help, we'll refer them to those services. We'll support positive change and help build community supports for that individual, guide them where they can get the support that they do need. Help people to achieve their life's goals, whatever those goals were. whether it was fishing or basketball, or I want to learn to bake cupcakes. Whatever that is, we're going to find a way to try to help that person to achieve that goal. And the recovery coaching is action. It's action, and we emphasize improving the person's life, the recovery's life. What can we do to help you to achieve your recovery? And we do that by providing encouragement and constant reminders about even our smallest accomplishments, because that's what it will take to move to the next stage, one step at a time. So we talked about that Vermont had a lot of recovery community centers. They have 12. They do recovery coaching in those recovery community centers. So this is what I can tell you, that in Vermont, when you look at this data, you can see that before recovery coaching is the dark black line, and after recovery coaching is the lighter gray line. So if you look at emergency room before recovery coaching, it was about 38% of the people. After recovery coaching, maybe 5% of the people needed ER visits. Doctors and primary care providers went up after recovery coaching, so people were getting help with their physical well-being. So substance abuse treatment, peer recovery support, everything went in the right direction. So recovery coaching, it works. People are drawn to it. They like the fact that the person that's helping them has lived experience. So another recovery coaching model was done in Rhode Island. And what Rhode Island did is they sent recovery coaches into their emergency departments. So if you came into the emergency department with an opiate overdose and you gave verbal consent, a recovery coach was called, and they would come to the ER within 15 to 30 minutes to talk to you. So this is the age range from up till 79, from the youngest 15 to 79. There were mostly males. And what they saw was that and they call them survivors, 112 survivors had been seen, and 88% engaged in some type of recovery support services. So the picture you're seeing on the screen says like what type of service those people went into. So some people went into outpatient. 46 people said they wanted to continue with recovery coaching. They had faith-based recovery support, medication-assisted treatment, and only 9 people of the 112 people that were seen said that they weren't interested in any services. So they had absolutely amazing results at the Anchor ED. And now Gosnold is a treatment center out on the Cape where they did some recovery coaching too. And what I'm going to show you next is based on a 1-year study of young opiate users. So these are people under the age of 24. And it was compared to data from the previous year where they didn't have a recovery coaching program. So that's how they did the analysis. So there were 54 people that enrolled in the recovery coaching program. Of these 54 people, they tripled their days in recovery. They reduced detox admissions by 40%. They reduced relapse episodes from 210 days to 3 days. 6,900% reduction. This is amazing. They reduced hospitalizations from 16 to 3, a 433% reduction. I don't even know if we can calculate the cost savings. The numbers would be so high. And check this one. Eliminated legal issues, 26 to 0. No legal issues after being enrolled in the recovery coaching program. So this has allowed people to start to maintain their recovery by having just a small bit of support, telephone recovery support, recovery coaching, all recovery meetings. There are little things that we can start to do to allow people the opportunity after they have treatment or make a decision that they want to be in recovery to actually be able to stay in recovery. So we need to advocate for these services, and advocacy does work. Last year on October 18th, we held our first annual We Believe in Recovery rally in Concord, and this picture was taken just as it started to rain, so not everybody was on the State House steps because some people were under trees, but we had over 5 people attend that rally, and this year we'll be hosting another rally, and we're going to have combine it with Inspired Recovery, which used to be a Manchester event that we're going to combine with the rally. It's going to be September 26th from 11:30 to 4:30 at White's Park in Concord. So there'll be Inspired Recovery where people can display their artwork. There'll be live music, poetry, as well as we're going to have a children's event, activities, face painting. We're going to be working on a recovery quilt there that we started last year. And it's a great way to get involved and show your support for treatment and recovery. And in this picture you can see at this rally we had people wearing purple sashes to indicate they had over 10 or more years in recovery. There's a couple people you can see in there. And there was over 1,100 years of recovery represented at that rally. So we also, as part of our advocacy efforts, coordinated with New Futures to have what they called a die-in at the State House because all the funding for the alcohol fund and the Medicaid expansion had been eliminated from the budget. And so over 500 people went to the State House and laid down to represent the 321 people who had died from overdoses this year in New Hampshire alone, which in the prior year was 193, so almost doubled. And then, so here's our information on Inspired Recovery, and we'd love to have people get involved. Feel free to contact me directly or through Kim. There's my contact information, info@recoverynh.org. Phone number in my office is 603-225-9500, 9540, and that's extension 120. So I'm not sure if I have any questions that are outstanding, but are recovery participants involved in funding with many recovery centers? So I think if I understand the question, people in recovery can help through, we're doing fundraisers to support recovery community centers. The actual person at this point that walks in the door, we're not asking them for anything, if that's what you're asking for about. We do have a fundraiser on May 28th at the Palace Theater in Manchester. We're hosting a screening of The Anonymous People. The cost is $10, and we're going to have a panel discussion and a 50-50 raffle that day to begin to raise money to open a recovery community center in Manchester. And if you are interested in that, we have a community meeting tomorrow evening, May 14th, at 6 p.m. at 161 South Beach Street, the Families in Transition building. And we love to see anybody who's interested in a Manchester Recovery Community Center come on down and get involved. So I guess That's all we have for today. Thank you all for attending. I appreciate it, and feel free to contact me directly. I'd love to talk to anybody interested.